Today I'm going to do a limb bandage. So first you place cotton wool in between the digits, in between the toes. This absorbs any sweat, prevents pressure and irritation. Good girl, stay. I'm now going to use the soft band. Good girl, you're okay. You're okay, Stella. Stay. Good girl. Good girl. Stay. We're going to go up the limb. Apply some vet wrap. Yeah, stay. Stay, Stella. Good girl, stay. 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 Good girl. I'm then going to use some of this one up the top just to make sure it stays on. I'm going to demonstrate how a urinary catheter works from home because we don't have any blocked animals in at work at the moment. So this is the urinary catheter. So this gets inserted into the penis and up the urethra. And obviously that little bit is the bit that stays out. So the vet will stitch that little bit to the outside, and that hole there is where the urine comes out. So with maintaining a urinary catheter, the animal should have a head collar on, a head cone on, an Elizabethan collar so that they can't bite at the area and so it doesn't come out or damage it. You need to make sure it's always dripping so you know that it's working. And with maintaining it also, it should be cleaned at least 2 times a day with saline. So that's maintaining a urinary catheter. When you're using anything to do with the urinary catheter, cleaning it and checking on it, gloves should always be worn. So this is Millie. She was the dog that was hit by a car. So she has some sutures underneath this bandage. So for wound care, she will go home with this little boot, and we will ask the owner to pop this on when she goes outside so it's nice and covered, it doesn't get wet or dirty. She won't be allowed any baths or any swimming, it must be kept dry and clean. She'll come back for a check and possibly a bandage change in about 5 days. And she'll go home with some antibiotics and anti-inflammatories as well. And she will go home with an Elizabethan collar just so that she's not licking or biting at the area. So it's important to check the fluid rate. rate to make sure that the fluid rate corresponds to what the vet's asking for or what's recorded on the chart that it needs to be. So for this patient it's 120 mils per hour. The volume to be infused should match what's up, either match what's up here or should be how much the vet would like the animal to have infused. So it's important to record twice daily the amount that has been infused. So volume infused for this patient is 3,454 mils. So that gets recorded twice daily as well. So with this patient, it's got a bag piggybacked for overnight because that's not enough to get it through the night. So we've added this bag of fluids on as well. So each check we do, we record the date that we placed the IV catheter. So that should be changed every 3 days. We record the fluid type, the fluid rate, total volume infused, and whether we've put on a new bag or not. So you need to flush the catheter a couple of times each day just to make sure that it's flowing fine. Make sure there's no air stuff. Good girl. Stay there. So I'm just going to pause the infusion pump for now. Good girl. So it's really important to keep an eye on their leg and to make sure it's not puffy. So if it's puffy, it means that the vein could have blown, which means the fluids are just going subcut under the skin rather than into the vein. So this is Juno. Juno's just in for some IV fluid therapy. Good girl. And Juno's leg looks really good. There's no puffiness. The bandage looks good. So it's important to check under the bandage as well. Make sure that it's nice and dry so you know that it's going into the vein. Good girl. Okay, so to flush the catheter and flush the line, good girl Juno. I'm just going to clamp it off at the end and I'm going to insert it into the injection port. Good girl. So that all flows through really freely. So it just unblocks any clots that may be there as well. Good girl. Good girl, Juno. You're okay. Today I'm going to perform a physical examination on Stella. First I need to confirm I've got the right patient. I've got Stella's cage chart which says she's a canine 10 stuffy 20 kilos. So I know, now that I know I've confirmed the right patient, I can start her examination. So her demeanour is bright, alert, responsive. So I'm going to check her heart rate using a stethoscope. I'm just going to check it for 15 seconds and multiply it by 4. So for the 15 seconds it was 30 beats. Multiply that by 4 is 120 beats per minute, which is in the normal range. So I'm going to check her mucous membrane colour and her capillary refill time. So her gums are pink. Good girl. Good dog. And her capillary refill time is less than 2 seconds when I press down, and it takes less than 2 seconds for it to return to normal. Now I'm going to check her respiration rate using the same method. I'll do it for 15 seconds and times it by 4. So Stella's respiration rate is 40 breaths per minute, which is in temperature is 37.9, which is a normal dog temperature. So I've ensured that I've recorded all those checks on her cage chart. Now I'm going to do a basic drug dose. Today I'm going to give Stella an injectable medication. So Stella's not actually due for any medication, so I'm just going to use water for injection. So we'll pretend it's Loxicon, which is an anti-inflammatory. So I'm going to work out the dosage for Stella. So the dose is 0.2 milligrams per kilo, so she's 20 kilos. So I do 0.2 times 20. We divide it by 5 for the concentrate, so she needs 0.8 mil. So I record that on her chart, and it's going to be given subcutaneously. So I'm going to draw up the medication. I need to make sure that air bubbles are out and pop on a new needle. So I've drawn up 0.8 mil. I'm going to give it in the next graph subcutaneously. See? Good girl. See? Okay, so I've got it in the correct position. So I'm going to draw back to make sure there's no backflush, and I'm going to give the injection. Good dog. So I need to make sure I put the cap back on and dispose of the sharps in the sharp container. Now make sure I record that on her cage chart. Stella's having a nail trim today. Good girl. Good dog. So I just have to be really careful not to get the quicks. Good girl, Stella. Good girl, you're okay. Stella's nails are already quite short, so I don't have to take much off. Good girl. This one? Good girl, Stella. It's okay. Stella, it's okay. You're okay. Good girl. Good girl. Good job. You're such a good girl.